Welcome to the Explorer's Life and Learning Hub, where we explore women's health with honesty, compassion, and hope. Have you ever suffered stigma due to uterine fibroids? Well, today's message is for anyone dealing with uterine fibroids, those quiet growths that can cause heavy periods, discomfort, or challenges with fertility. If you've been told you have fibroids, you may wonder what kind of treatment is right for you. Not every fibroid is the same, and neither is its management. Let's explore the treatment options, type by type, so you can understand what's possible for your body and your health. Fibroids come in different shapes, sizes, and locations, and these differences guide the choice of treatment. 1. Submucosal fibroids. These grow inside the uterine cavity, just under the lining. They are often linked to heavy menstrual bleeding and fertility issues. The best treatment for submucosal fibroids is hysteroscopic resection. In this procedure, a small camera called a hysteroscope is inserted through the cervix. Using fine surgical tools, the fibroid is shaved away from the uterine wall, no external cuts, no abdominal incision. This method is effective for small or moderate fibroids. Most women go home the same day and recover within a few days. They can try to conceive as soon as their next cycle if there are no complications. For larger submucosal fibroids that can't be removed in one session, doctors may perform the procedure in stages, ensuring safety and complete removal over time. 2. Intramural fibroids. These fibroids grow within the muscle wall of the uterus. They may cause pelvic pressure, back pain, or heavy periods. When they are small and not distorting the uterine cavity, they may not need surgery. However, if they are large, painful, or affect fertility, an abdominal or laparoscopic myomectomy is often recommended. Laparoscopic myomectomy uses tiny incisions and a camera to remove fibroids with minimal recovery time. Abdominal myomectomy is done through a larger incision and is ideal for very large or multiple fibroids. After these surgeries, healing usually takes 3 to 6 months before trying to conceive. This allows the uterus to regain strength and elasticity for a safe pregnancy. Medication like GnRH agonists may be used before surgery to shrink fibroids, making them easier to remove and reducing blood loss. 3. Subserosal fibroids. These fibroids grow on the outer surface of the uterus and can press on nearby organs like the bladder or intestines. They rarely affect fertility unless they become very large. Treatment depends on their size and symptoms. Small subserosal fibroids that cause no pain or pressure can simply be monitored. For larger ones, a laparoscopic or abdominal myomectomy may be performed to remove them and relieve pressure on other organs. If symptoms are mild but bothersome, a uterine artery embolization might be an option. This is a non-surgical procedure that blocks the fibroid's blood supply, causing it to shrink over time. However, this option is generally not recommended for women planning future pregnancies, as it can sometimes affect uterine blood flow. 4. Pedunculated fibroids. These are fibroids attached to the uterus by a thin stalk, either inside or outside the uterus. When located outside, they can twist, a painful condition called torsion. The most effective treatment for pedunculated fibroids is laparoscopic removal, especially if the stalk is thin and accessible. The surgeon identifies the fibroid, cauterizes the blood vessels, and removes it safely. This procedure typically allows for a quick recovery and minimal scarring. When pedunculated fibroids are inside the uterine cavity, hysteroscopic resection may be performed. 5. Cervical or parasitic fibroids. These rare fibroids grow in the cervix or detach and reattach elsewhere in the abdomen. They can complicate urination, sex, or childbirth. Treatment for these fibroids usually requires abdominal or laparoscopic myomectomy, depending on the size and location. Because cervical fibroids are close to important structures like the bladder and urethra, surgery requires special care by experienced gynecologic surgeons. Other supportive treatments. Sometimes, fibroids don't need surgery at all. For mild symptoms or when pregnancy isn't a concern, medication can help manage the condition. Hormonal birth control can reduce bleeding and cramps. Progesterone-releasing IUDs thin the uterine lining and ease heavy flow. Tranexamic acid reduces menstrual bleeding without affecting hormones. GnRH agonists can shrink fibroids temporarily before surgery or menopause. Lifestyle changes, like maintaining a healthy weight, reducing red meat, increasing vegetables, and getting enough vitamin D, can also make a positive difference. Planning for pregnancy. If you plan to have children, it's important to tailor treatment to protect fertility. Always discuss your reproductive goals with your doctor before any procedure. A fertility assessment before treatment helps determine the best path forward. If needed, you can consider egg freezing before surgery as an extra precaution. Healing after fibroid removal is gradual, but it's a journey toward balance. Patience during recovery helps ensure your uterus is ready for a safe and healthy pregnancy. Emotional and physical healing. Dealing with fibroids isn't just physical, it's emotional. Pain, fatigue, and uncertainty can take a toll. But remember, you're not alone. Millions of women have faced this and found healing, hope, and motherhood on the other side. Recovery means rest, nourishing food, gentle exercise, and emotional support. Talk to your doctor, join support groups, and stay informed. Your body is capable of remarkable healing. Every day, it works quietly to restore balance and strength. If you're walking through this journey, remember, fibroids are not the end of your story. They are just one chapter, and healing is absolutely possible. You have options. You have support. And you have time to recover and rediscover your strength. Thank you for joining me here at the Explorers Life and Learning Hub, where we share knowledge, care, and hope for every woman's health journey. If you found this message helpful, like, share, and subscribe, because together, we can empower more women to take charge of their reproductive health. Stay strong. Stay hopeful. And as always, stay fabulous. Disclaimer: this video is only for educational and entertainment purposes and not medical advice.